today is World Diabetes Day, and as you guys quoted, the theme is breaking barriers and bridging gaps. So I just want to explain that theme so people understand where we're going. What are the barriers? You know, before we used to see a person with diabetes just as a diabetic patient. We only treat the sugar. But researchers have told us that over 83% of people who had diabetes developed anxiety, stress. 55% of them have fear of needle. 76% of them felt they were discriminated. So there's a mental challenge, there's a mental burden. So what the research is trying to say is that you shouldn't just look at this person from the diabetic point of view, but you have to look at the person holistically. Look at the person before having diabetes and now having diabetes. And so that's the approach Ministry of Health wants to take. I look at you that, oh yes, Mr. Ishmael, even though you have now diabetes, but no, I have to look at how you are working, what are the things, your lifestyle, and all of those things, and then we'll be able to deal with it the way it should be done.
So in other words, Dr. Conteh, you're saying that somebody's medical history has to be ascertained, because the thing is, like you're saying, there are a lot of other issues, implications or complications that come along with diabetes. So, but we are living in a country where people have this there's this culture deep rooted in the way we do things. People hardly go for medical checkups for them to know their medical conditions. So how do you think that could be addressed?
I think that's why you see the Ministry of Health is trying to broaden our scope of health education. One challenge we have as Leoneans, we think it's nice to have a barber, it's nice to have your car mechanic, but it's not. It's nice to even have your lawyer, but it's not good to have your doctor. And it's not expensive to have a doctor. It's very cheap. People think really? It's millions. It's cheap, trust me. The thing is, when you have a doctor, the doctor knows your history, even if you are asleep. Okay. The doctor knows you. So let's say by adventure you are somewhere else out of the country, maybe you fall in coma. But once you have a doctor, they say, oh, Dr. Conteh, this your patient is having this trouble. Also, yes, he's my patient. I know these are his conditions. Give him or her these medications. So please, I encourage us. But another problem here is that we don't seek the right help. Okay. For instance, people are wrongly diagnosed of diabetes. The moment they see you have a high sugar, which we call hyperglycemia, they tell you are diabetic. That is not diabetes. For you to be diagnosed diabetes, there has to be at least 2 of different stages at different times. So the first one which we do, they do the pricking, which is called the fasting blood sugar or the random blood sugar. And there's another one, we go on the glucose intolerance test, or we do the glycosylated hemoglobin. So once those tests has been done, then we can be able to make a proper diagnosis. So that's one point Ministry of Health is trying to put across. Go to the appropriate facility. All of the hospitals in the country are able to do those tests. Once you go there, then you'll be properly diagnosed. And after the diagnosis, we shouldn't just look at the sugar that is high in you. We should look at your entire life and employ a plan. For instance, your lifestyle. Some of us are living now sedentary lifestyle. All the time we're at home, we're on the computer, we are, all of these things are affecting. And so that holistic approach is what Ministry of Health is now pushing forward.
Now, Dr. Conteh, part of advocacy for, as part of celebration for World Diabetes Day this year is for, proper healthcare facility to be provided for those diagnosed with, of course, the condition of diabetes. But they usually say prevention is better than cure. How can one prevent oneself from getting the condition of diabetes?
That's a very good question. First of all, I think we just went too fast. But you were saying when the rice is sweet, you just eat it fast. We're just eating it fast. But I think let me just briefly, we know what is diabetes. Okay. We have several types of diabetes. We have type 1, we have type 2, we have the gestational diabetes, we have the maturity onset diabetes, we have the ladder. But the 2 main broad terms we talk about is type 1 and type 2. Type 1 simply means the body does not produce insulin. Because insulin is that thing we produce in the body. No matter the amount of sugar you have in the body, it's able to bring it down into the system. That's type 1. So that is why people who have type 1 diabetes, they depend on insulin, which is called insulin dependent diabetes. Type 2, they have insulin in their body, but it's not enough to do the work. So once in a while they give them insulin, but in addition to that, we give them the metformin, the Downhill, and other medications. Broadly, those are the 2 types. So diabetes, once it has been diagnosed or before being diagnosed, it comes with symptoms. What are some of these symptoms? We have what we call polyuria. Polyuria means you urinate frequently. The frequency of urination increases. So somebody will tell you, I woke up 6 times at night to pass urine. That's polyuria. Another thing is polydipsia. Polydipsia, the person feels thirsty, he drinks the water and feels thirsty again. So the frequency of feeling thirsty and drinking water increases. Another thing is what we call polyphagia. Polyphagia, you feel hungry, you eat, you feel hungry again. That is why actually most diabetic people are obese.
Okay.
Because that's a symptom. There are also other symptoms, there are other complications, like it starts to have blurring of vision, you have to have numbness on your lower limbs, and when those things come in play, you need to see a doctor.